I do think this category of innovation, with all of the companies we've been talking about, is what is healthcare has been waiting for, which is a solution that improves quality, lowers cost, improves access, sort of the triple aim of healthcare. It really can only come from step change improvements in technology innovation. I think that's what we have today.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Muthu Alagappan, founder and CEO of Counsel Health. In this episode, we discuss building an AI-native primary care platform. Muthu shares how Counsel combines autonomous clinical reasoning with human doctors, enabling low-cost, high-quality care delivered entirely through messaging. Plus, we talk about the future of clinical care powered by AI. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Muthu. Welcome to Fitt Insider. Thanks for joining us.
Hi, Joe. Excited to be here. Thanks for having me.
Yeah, to kick things off, could you introduce yourself and tell us about Counsel Health, and then we'll jump into the convo.
Sure. So my name is Muthu Alagappan. I'm the founder and CEO at Counsel Health. My background, I'm an internal medicine physician by training, so trained in Boston, where we still live. Was on the faculty at Mass General and UCSF. But before I was a doctor, I was an AI researcher at Stanford, publishing papers and developing techniques of AI in healthcare. So I've sort of had this 15-year obsession with both clinical AI and the practice of medicine, and has been extremely exciting to see those worlds converge. Counsel is an AI native primary care platform. So we deliver primary care via a hybrid of AI and our own human doctors working side by side in an interwoven pattern. And all of the care we deliver is via messaging. The reason for that is that consumer preference and desire for messaging as a form factor for receiving care has sort of skyrocketed in the last decade. And consumers already use messaging to interact with many other domains of their life. And so we're really excited and bullish on a platform where you can access primary care within seconds in your pocket via a few messages and have that care delivered at really high quality, but at far lower cost than has ever been possible because of the hybrid of AI and human doctors working together.
There are a bunch of different things I want to dive into, both as it relates to Counsel specifically and zooming out in terms of AI and healthcare, which a whole bunch of buzzwords and announcements and hype, and I think questions that people have. But just so we get a sense, maybe from like a patient or just use case perspective, is there a typical kind of interaction or experience that someone might have, or how are they interacting with Counsel and how is that care being administered?
Yeah, we often say think of Counsel like a doctor in your pocket or a doctor in your family. And so Counsel is accessible on our website or via our mobile app. So you would create an account and then effectively turn to us for any of your primary care needs. So we call these modules on the platform. So one of our modules is reviewing your results. So you can upload an MRI report or a PDF of your recent lab results or an X-ray, and we can help give you a comprehensive review of those results. Maybe you need to request a referral or renew a medication, or you have the flu and you need Tamiflu. Any of those things, you can come to us for web or mobile. The interaction always starts with our medical AI doing a history and collecting information and providing some initial guidance. So you may have several back and forths with our AI. Our AI has access to your medical records if you grant us access. So even from the very first turn of the conversation, it's going to feel like talking to an AI agent that's known your health history from your entire life. Now, the interesting thing about Counsel is that we don't stop just with the medical AI information. At the right time in the conversation, we'll actually suggest to you if a doctor is needed. And so with a single sort of click of a button, you can add a real Counsel doctor to the same conversation you've been having with our AI. And that seamless handoff allows you to go from medical information to actual medical care. We can write a prescription, order a lab test, make a referral, renew a prescription that is now outdated, and we can do that all again within a few messages and a few clicks. And with counsel, when you have that doctor interaction, we're often checking back in with you in a day or 3 days or a week. And that's why we say it feels like having a doctor in the family. It's not that you would hang up and never hear from us again. The platform is really intended to be quite continuous and longitudinal, and to really get to know you and serve you over time. And that's why people use us today.
The other side of that, obviously, it's a whole host of benefits for the clinician, for the doctors who are maybe not navigating things in the typical 15, 20 minute, hey, you're in the office, hey, you're out of there, or a typical like telehealth visit. From that side of the equation, how are you kind of amplifying them? And are they employees of the platform? How are you engaging them and the clinicians on that side?
Yeah, we made a very intentional decision from day one to own and operate our own medical practice. And that was very important to us for a few reasons. One is we wanted to have full control and liability over the delivery of care. Right? We didn't want to stop at just being a chatbot. We wanted to actually be a full service care provider, someone who could not just get you to the right answer, but actually get you the solution to the problem that you're having. So we built a 50-state medical practice as one of the first things we did. The other value to having a medical practice is that our physicians can give feedback to the AI as it is sort of conversing with the user. And so, just like in the hospital, if I were to train a medical student or a resident by giving them feedback as they're presenting to me, we have that same advantage and built in feedback loops from our doctor back to our AI, which allows our own AI frameworks to improve. Now, the way it works for our providers, so they're mostly employed either in a full time or part time capacity directly by our medical group. They practice within a software application that we've built that we call our clinician cockpit. Think of it like Cursor for doctors, or we used to often say it's like an Iron Man suit for doctors. It is a care interface that allows our doctors to effectively deliver primary care in just a couple of clicks, right? And the vision here is we can get to the point where the AI is doing so much of the upfront information gathering and cognitive work that the visit itself is just a single click for a doctor. What you alluded to today, I've practiced primary care on both coasts. You may see 2 or 3 patients an hour, right? 20 to 30 minutes a visit. Doctors at Counsel can see 15 to 20 plus patients per hour. And that's because of the clinician cockpit that sort of takes a lot of the heavy lifting off their plate, that serves as a extremely smart medical resident that is reasoning along with them, serving up the plan and allowing them to approve or deny in a single click. And I think that's where we get to this vision of primary care visits that cost less than $1.
Already in kind of hearing you describe this, there's a couple of things that just jump out, maybe relative to other, if you want to call them consumer healthcare platforms, AI powered, is it a chatbot? Ultimately, they span the spectrum of a wrapper on some type of care that is not delivering kind of primary care or medical practice that you're talking about, all the way to maybe like a healthcare or longevity optimizing membership that layers in healthcare. As I'm even talking about that, as someone who's pretty immersed in the space, it's confusing to me, right? And making sense of where everybody sits on that. You've already pretty much distinguished yourself in saying, we have a medical practice, we are employing the doctors. It is intended to be primary care, and we want to deliver it more efficiently and cost effectively. That goes in kind of direct opposition to a lot of the things that you're hearing in terms of, we are not primary care, we are not intended to replace your doctor, we are not able to maybe prescribe things. How were you able to, and how are you able to message this in a landscape, I guess, that is getting kind of muddied with what is healthcare, what isn't, how, who's leveraging AI and how, and then how does that actually result in outcomes, in terms of like health outcomes, longitudinal data, those sorts of things?
I would really probably draw the divide between medical information and medical care. And medical information is a sort of a sub bucket of primary care that for many years has been done better by technology than it has by humans, right? So from the advent of Google search, it has probably been the case that you are better off getting medical information at your own disposal through a Google search query, of which I think even today there's a billion healthcare questions asked on Google every day. And so In the medical information bucket, you have a factual question that you want an answer to or research on. Google or a chatbot can do a really good job of surfacing the right answers back to you. But primary care as a concept is a lot more expansive than just getting someone the right answer at the right time. Primary care encompasses collecting data about you, vital signs, biometrics, lab tests, screening tests. Primary care encompasses preventive care, making sure that you have the right vaccinations and you're up to date on cancer screening and that you're eating healthy and exercising. It has a component of urgent care. When you have a sinus infection or sprain your ankle, who do you turn to? Who's actually wrapping your ankle, giving you antibiotics? And then it has a component of chronic care, which is how do you manage conditions that may never go away? Diabetes, acne, PCOS, high blood pressure. And so my mental model is to think of primary care as that expansive umbrella, of which 100 years ago, a single human tried to do all of those things. And now we're seeing those many sub-buckets become disaggregated and disintermediated by virtual players. So there are companies that are really good at just doing preventive care, at just doing screening, at just doing urgent care. And then there's platforms like Google and ChatGPT that are really good at doing medical information. And that's sort of how we think about the space. And with a platform like Counsel, we are in essence almost trying to re-aggregate what has been fragmented and saying, can you turn to a single platform that can give you answers, that can give you care, that can help you get actionable results, all in a single place where your health history is also known. And I think that's a compelling vision, especially if we can do that in an AI native manner, which means that we can deliver effectively a concierge experience for orders of magnitude lower cost than you ever could before.
You also kind of alluded to this superpower, supercharged clinician cockpit, almost like cursor. And that kind of draws the, analog to in the kind of tech world, like a 10x engineer, right? We are supercharging these developers and the output that they're able to do, their productivity, et cetera. From the clinician side, have you started to get the sense of, because obviously the conversation is we're using AI to then make the human intervention even more powerful. We know when we need to have that human in the loop and they're able to do things that the AI is not able to. Is it clear at this point, like what that is? Like when does the human kind of step in? What is it important to have that 10x doctor maybe doing that they weren't able to do before that they can do now within Counsel?
There's primarily two reasons why we would have a human step in. So basically, for any clinical use case or even any message in the conversation, we essentially have two choices. We could either have the AI respond and do the clinical reasoning or the doctor. And so you can think of every turn of the conversation as sort of a choice we're making of, is this the AI that's going to answer or the doctor? Those are our two sort of mediums of communication or work. And the two reasons why we would pick a doctor to be the one to respond is one, there is some regulatory reason why it has to be a doctor. So either there's a state practice of medicine requirement that says, technology is not allowed to diagnose and treat, and hence it has to be a human doctor who's licensed in that state. Maybe it's FDA oversight related, but there's some regulatory reason that we say this has to be a human that's doing this, even if we feel very confident in the AI being able to do it. So like prescription renewals is a great example. We feel very comfortable with an AI sort of renewing prescriptions or getting to the right diagnosis in urgent care, but we will still have the human communicate it because most states, require that. The second reason why we would have a human do it is that we just don't have confidence that the AI is advanced enough to do that use case. And so maybe it requires a very complex multi-step reasoning around the right treatment, or maybe the AI hasn't proven that it won't hallucinate in this one specific use case. And then we'll have a human do it as well. Over time, both of those vectors will get more favorable in the direction of AI, right? So regulation will ease and improve such that the AI can do more and more, and kind of core algorithms and performance will improve such that the AI will just be actually a better, more accurate answer for almost every use case. And I think that's where our optimism and ambition comes from, is we definitely see a future in which a lot of this work can be done very effectively by an AI with a human in the loop if necessary. And when you have both of those at your disposal, I think that's when you can construct really powerful care models.
Is it clear at this point? Because there's obviously claims up and down the spectrum of, there's not going to need to be human doctors. It's going to be completely replaced or replaced to whatever extreme percent. Does counsel have a perspective on that? Is there an end goal that, if you listen to in other industries, maybe robotics, like we don't want humans doing X type of work into the future. There's going to be no Uber drivers in one example. How do you see that playing out in the medical field as it relates to the doctors and physicians who are doing this work today and into the future?
It's interesting. It's a great question. We kind of intentionally at Counsel don't use the term AI doctor very often because I think it presupposes two things. One, it presupposes that all doctors are fairly similar to one another, which couldn't be farther from the truth. A vascular surgeon versus a geriatrician are effectively, they might as well be two different professions altogether. In fact, I think a PCP probably has more in common with a financial advisor than they do with a vascular surgeon. And so the word doctor, the idea, could you have an AI be a doctor, it's sort of too broad of an umbrella term. I think that's one issue. The second is that we're also not convinced that every aspect of this, of the clinical part of practicing medicine, has to be done with AI versus just traditional software. So an example of that, there are many clinical use cases that are very well served by a smartphone, as opposed to a large language model as the technique to enable that use case. And I think we've gotten very caught up as an industry that the path to automating clinical actions has to be AI, when in truth, we may find that only a portion of it actually is using AI. And the other portion, you can actually build a digital doctor. We've been talking about that for decades, using both deterministic workflows as well as sort of large language models and other techniques. So all of that being said, it does feel like most of the cognitive aspects of practicing at least primary care over the scale of time will be done better by an AI. I think AI will over time be more trustworthy. It'll have better bedside manner. It'll be a better coach. It'll be better at retrieving and answering questions. It'll be better at making medication decisions, titrating medications, checking for drug-drug interactions. It is hard to fathom a cognitive aspect of the practice of medicine in primary care. Again, a lot of caveats, but like cognitive aspect of primary care that like a technology system is just not better suited to do than the human brain. Even the very soft aspects like emotional, creating emotional bonds and getting someone to really trust you. I think we're already seeing evidence in other industries and with therapy chatbots that AI actually can do quite well. In fact, maybe too well, to a point that it's kind of disconcerting. So I think that's where we see that headed. Now, will there still be a place for humans? I mean, someone still has to provide the vaccination, to wrap the ankle, to potentially listen to the heart or the lungs, and so there will be aspects where humans are still involved, I think. But hopefully that sort of gets at the answer.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. I think I just saw a clip somewhere of a robotic phlebotomist drawing blood, doing that. You just kind of walk up to a machine like you would the blood pressure check at CVS, and now it's a blood draw. So we'll see. Things are happening pretty quickly. Along those lines, there have been a number of kind of AI healthcare product releases from OpenAI, from Anthropic, all the way down the line. It seems like more and more every day. When you were talking about this being like a question answer, right? Getting to using something like ChatGPT in the same way that you would use Google maybe. Is it realistic that, they become an integrated care delivery platform. There's not so long ago, even like in Amazon, they've made strides in healthcare and pharmaceutical and so forth. The thought is when you're talking about a 4 or 5 plus trillion dollar market for a large trillion-dollar technology company, they have to go into these larger markets. Just how realistic is that? What type of challenges do you see them encountering, or are you encountering at council that says like, look, this is a lot harder than it looks in terms of just saying, hey, yeah, we can make a HIPAA compliant chatbot and start to analyze labs maybe?
I think it's a really exciting moment because I think it's lending validation to the idea that chat and messaging is a viable form of engaging with your health. For decades, consumers probably felt like if you didn't go in person and see someone when you had a sore throat, like you were not getting good care. And then we sort of shifted to like, okay, as long as the video visit, it's still like that's good enough. And I think we're now like, I think the market is now getting educated that chat and messaging is actually a very viable form of engaging with your health. And that's, I think, largely thanks to platforms like OpenAI and ChatGPT that have made that feel more credible. So I think that's one thing that's important to underscore. I think it's very possible that those platforms morph into integrated care delivery systems. And the question is, would they do that with their own provider groups or in partnership with an ecosystem of providers? The thing that's always been true about primary care is it's really hard to do primary care in isolation. It almost doesn't exist in isolation. Primary care, by definition, is the primary point of contact for a person so that you can then get routed to the right secondary or tertiary point of contact if needed. And so the idea that anyone, them or us, can sort of do this in isolation without plugging into a broader ecosystem, I think is also, fairly tough. And then going beyond that, I think it depends on what aspect of that clinical umbrella are you going after. And we talked earlier, if you're going after providing the best medical information possible, that means that you're evaluating and training your AI platforms in a certain way to be optimized for information retrieval. If instead your goal is to manage heart failure, ARPA-H just announced a new program for managing post-MI or heart failure patients longitudinally. That's a very different clinical use case, and it requires a very different eval set and a very different sort of agentic framework. And at least today, it seems like companies like Counsel are more focused on that multi-episode care journey of many, many interactions over many, many conditions that are being stitched together to make someone feel better, as opposed to single interaction. I want to lose 10 pounds. What's the best diet? And again, those are different clinical use cases and hence probably will be approached in different ways. And we're, I'd say, more on the side of longer care journeys.
Yeah, it's interesting as you're, talking about this and even saying whether it's council or somebody else, like being able to integrate into the broader system is going to create a number of bottlenecks because they'll be at different levels of adoption of any technologies, AI or otherwise. And then there's an additional layer of even if we succeed, the healthcare industry in making this kind of switch, there's still the question of people have to take action. Like the adherence, the lifestyle behaviors, the habit change. Those are two very different questions, obviously, but just the idea that are you already encountering these kind of bottlenecks? Let's say you do that triage of, hey, this is where we need to route people and this is the next step. Okay, well, how do we integrate with that healthcare system? And then on the flip side, are the patients taking action on the things that we're telling them to do and the kind of solutions that we have for them already?
That's completely right. And one of the first things you learn in medical school is that just because you prescribe the right medicine doesn't mean the patient's going to get better unless they actually take it. And so the actual behavior change aspect of this, I think, has always been the hardest part about wellness and healthcare. And that is an entire sort of domain of like which type of platform is best suited to do that. And what are the different mechanisms of doing that? Do you have to do more proactive nudges? Do you have to have integration with biometrics and wearables and sensors to do that well? Or does change management come from just understanding the person? Like, are they more likely to listen to you if you can recount some detail about their past that makes them feel, really heard or understood by you? So completely agree. And I think the integration with the system, I think when the first versions of ChatGPT came out, it was magical enough just to see the answer show up. And I think now what we're seeing as our expectations have risen is you don't want to just see the answer. You want to see, you want to have the checkout button for your Instacart in the experience itself. And so I think the tight integration, and which for us, that's why I started off talking about a single button to add a real human doctor to a chat. To us, that's the equivalent of a buy it now. We call it add a doctor, but it's sort of the buy it now button for healthcare, which is okay. I've got the answer. I want to in one click now get the solution.
I kind of alluded to this as part of, I think, a loaded question. So we may have kind of stepped over it, but just the realistic challenges and bottlenecks that you're encountering now, because walking through it, everything lines up in terms of why this would make sense, how it adds value, where it's going to excel kind of far beyond the limitations of a human doctor in many ways. In the fall, you guys raised a Series A round. I think it was $25 million. So obviously, growing the business and thinking about those challenges and also what's next. What is it that's kind of top of mind for you and the team that you're most focused on, whether that's where kind of growth is or where the biggest kind of challenges are at the moment?
Yeah, I mean, I'd say the space is extremely dynamic. I've been in health tech for about 15 years, and I don't think we've ever seen a time that was moving as dynamically in as many dimensions as we are now. Like, people talk about, shooting a basketball with a moving goalpost, let's say, but here it feels like we're moving, the goalpost is moving, and the ball is changing sizes, as we're doing this. And the dimensions I'm referring to is, what is the FDA doing about regulating these devices? What are the states doing? What is the reimbursement landscape, which is very uncertain for AI sort of augmented care? What are health systems doing? Health plans? What is consumer behavior? What are the frontier model companies doing? And then all of that, we're trying to assess where is scarcity and where is sort of value accruing. And so in a pre-ChatGPT world, scarcity may have just been in getting answers to getting medical advice in a narrative form very quickly. That's no longer scarce. It's, for free in many different platforms, you can get that. So now what is the new bottleneck? Where's the new scarcity? Is it the doctor? Is it the prescription? Is it something else? So, to your question about challenges, those are the types of things we're constantly evaluating. For example, another one would be what are the technical problems that we want to invest R&D resources into versus what are the technical problems that we think the foundation model companies will solve as just part of making their models better, and hence we don't need to invest our own resources in. Like, are they going to get will they make such a dent in hallucinations or in instruction following or in alignment that we can sort of just sit on top of that as opposed to having to solve those ourselves, and which are the ones that we think are actually going to be proprietary to us. And challenges, exciting areas, but it has felt more dynamic and I think fast moving than I've ever seen.
As those things, because they are changing so quickly and, trying to keep up, but there's obviously a ton of uncertainty. How does that kind of impact your thinking around the business model? Because that kind of directly relates to the scarcity. It's like, okay, where's the margin? Where's the arbitrage? Or like, where are you continuing not only to differentiate in terms of the service, in terms of the research, in terms of the innovation, but just what people are willing to pay for and what they're able to get at a very low cost or free elsewhere?
Where we're seeing a lot of scarcity is in the actual clinical resource to deliver the action, even though the knowledge of the action, right, knowing what dose or what medication to prescribe may have become fairly easy to access. Actually getting it done, I think, is still quite complicated and still quite hard. We're also seeing value accrue in the longitudinal relationships with patients, being able to track a single condition over time, again, as opposed to just sort of single episode type care. And then the question is, what is the consumer's willingness to pay for these things versus who are the other potential sponsors of this kind of service? And so you think about if a consumer can get primary care for really low cost, high quality, who else benefits? Health plans benefit because traditional primary care visits are certainly more expensive than they would be in this type of model. For health systems, primary care, again, is an entry point into the suite of services they offer. And so there's definitely interest on the health system side of sort of creating better entry points into their delivery networks. For the government, better preventive care means maybe less spending in Medicare down the line. And so you can sort of map out what the value propositions are, but this is far less straightforward of a business than building an AI sales coach or a AI note taker, where it's a very one-to-one problem to solution to willingness to pay framework. Here, you've got a lot of asymmetric multi-stakeholder alignment on the value prop side. But all of that being said, I do think this category of innovation, with all of the companies we've been talking about, is what is healthcare has been waiting for, which is a solution that improves quality, lowers cost, improves access, sort of the triple aim of healthcare. It really can only come from step change improvements in technology innovation. I think that's what we have today. And so I think we'll figure out, we being the collective, we will figure out sort of the go-to-market business model viability. There's enough interest in the space that I think that'll happen. And I think ultimately it'll be quite great for healthcare.
Early on, you, I think, differentiated yourself from a lot of maybe consumer facing or AI driven, maybe preventative care platforms, longevity platforms, health optimization. There's obviously a lot of interest around that space. And, with that, it tends to get a lot of headlines and coverage. Some, kind of hyperbolic about what's possible in living hundreds of years and all these things. But where you sit in the kind of primary care space, what we didn't talk a lot about today is like the role of prevention and companies doing lab testing and bolting that onto wearables and doing that with preventative screenings and whole body scans. Like the longitudinal aspect of this, tracking people in care over time, being able to prescribe medication. Are those, I guess, are those two totally different things? Are they compatible? Do you see this like necessity and interest and focus on the prevention versus the kind of primary longitudinal care? I guess I'm just kind of trying to make sense of like what's happening in the market. And we're almost talking about, well, not almost, we're talking about two entirely different things that oftentimes get like lumped together in the same conversation.
Yeah, I think we haven't spent as much time talking about those companies today, but I think those companies have made massive, important contributions to the overall space. They've taken something that used to be within the realm of your doctor had to be the one to check your blood pressure or your heart rate and document it and then order your lab tests. And we've now sort of democratized access where you can generate far more data about yourself without anyone sort of curtailing that or guarding that or having to approve it. And I think that's been phenomenal. When you think about medical accuracy, it really relates to how much knowledge do you have about medicine, and then how much knowledge do you have about the patient. And the combination about knowledge about the whole space of medicine and the knowledge about that particular patient is what gets you to accurate decisions. Large language models have given us a lot of knowledge about the practice of medicine. And companies in the wearables and lab testing and preventive care space are now giving us lots of data about the person. And with that combination, I think you can make really excellent care decisions in a way that was really never possible before. And so in general, we've been very supportive of companies that are leading in the preventive care and data generation space. And, we have believed that augmenting that type of data with the ability to then reason on that data and make care decisions is very much seems like a direction that healthcare is heading.
Do you think we kind of trend in this direction of, because a lot of those companies, even now, and I've seen some of the pitches, it's basically like, hey, we're going to start over here at maybe the labs or the wearable or the scan, and then we're going to do the primary care AI doctor layered on, integrated. Is that, when you think about the kind of fully integrated, full stack nature of that, is that just pie in the sky? Is that the direction you think things will end up going? Is that even a future where you sit at council, you're like, yeah, we could do everything up and down that spectrum, or you're more in the, hey, we can be the layer on top of all these different things that integrates everything?
Yeah, I think for a company like ours, having a singular, really passionate focus is very, very important. And for us, that is autonomous AI clinical interactions in primary care that are really high quality and low cost. And we're sort of entire company is singularly obsessed with that focus. I think in the scale of time, I think you're totally right that we'll see a lot of these trends converge, and there will be sort of full stack services that are able to do the combination of those things. I think where we're at today, we see primary care as being one of the most underserved specialties in America. There's 100 million people that don't have a relationship with a doctor. Demand is so far exceeding supply that you could double the number of doctors overnight and still, have a massive shortage. And so, again, singular focus, and in a space that I think has massive demand and is very underserved. And there's probably going to be many players that can help come and fill that supply. And then I do think over time we'll see a lot of these trends converge, and maybe those companies going more into primary care and primary care companies going more into other aspects. But I guess we'll see how that pans out.
Yeah, we'll certainly be keeping tabs on how all that plays out. Seemingly, who knows? It could be, 6, 8 months at this point. It feels like some days. In terms of what's next, anything we should look out for, you're excited about that you want to share with the audience?
Well, like you said, I think time is moving at a different scale now than it ever has. And so I think even in 3 or 6 months, we'll see massive progress in the space overall. From our perspective, I think we've made tremendous progress across a number of workflows that allow us to essentially do primary care visits with a single click from a doctor. And we'll be publishing over the next few months more of our updates and progress, building in public, helping sort of lead the conversation on what it takes to sort of build these digital autonomous doctors. And just anyone out there as well, our product has been completely free to use over the past many months at app.counselhealth.com. And so we're always eager to hear people's stories of using the platform, getting care, getting better, and hopefully we can make a difference there.
Perfect. We will make sure that kind of access is easy to find in the show notes, and certainly be looking forward to the kind of research that you're putting out there and the products that you make. It's an incredibly fast moving space, super impactful. So really interested to see how it continues to progress. Thanks so much for making some time to chat with us today.
Thank you so much, Joe. I really enjoyed it.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.